Hi everyone, this is Dr. Bill with EZ2PASSNCLEX, EZ2PASSNCLEX.com. In this session, I'm going to be talking about obstructive sleep apnea, OSA. What is obstructive sleep apnea? That is mainly when the muscles around the neck area relax when you sleep, right? So in this case, it's difficult for air to pass through, which makes it harder for air to be in your system or circulation. So what happens when this, is the case? In this case, when the client sleeps, they wake up and try to gasp or catch air because they can't get air to pass through. Hence why the name obstructive sleep apnea. So basically there's an obstruction, while you sleep. What are some risk factors of obstructive sleep apnea? Risk factors include obesity, people who gain weight or have bigger neck muscle area. Also, it increases with age. What are some classic symptoms that you identify with somebody diagnosed or suffers from obstructive sleep apnea? Signs and symptoms include headache. When people wake up with sleep apnea, they have headaches. They have lack of oxygen, so they may lead to hypoxia. They have increased daytime sleepiness or somnolence. So basically, no matter how much sleep they get, they still wake up tired and fatigued, okay? And this can lead to depression and other mental disorders. One of the main issues is daytime sleepiness. Sometimes people are driving and then they're falling asleep because they have sleep apnea. Snoring or heavy breathing during sleep. And then mainly they have episodes of apnea. So when they're sleeping, they wake up trying to catch their breath because there's no air passage. So what are some treatment approaches for obstructive sleep apnea? Sometimes in the late form or when everything has failed, surgery may be indicated. That's usually the last resort. The surgery may be done to remove the tonsils or the adenoid. So tonsillectomy or adenectomy. So before we get to that point, what can be done to help this client with obstructive sleep apnea? Mainly, you want to make sure the client loses weight. So weight loss is a big recommendation, with people with obstructive sleep apnea. Sleep on one side, mainly the left side, which, reduces cardiac workload, or it reduces the workload of the heart and the lungs. So sleeping on the left side sometimes helps, or sleeping with the head of the bed elevated expands the lungs so air can go through. Decrease alcohol. Alcohol tends to increase sinus pressure. So you want to teach the client to avoid alcohol intake. And then finally, they may be recommended for sleep studies. Sleep study will be recommended to identify how much pressure there will be needed for CPAP management. And CPAP is basically a machine that supplies continuous air to the client. So continuous positive airway pressure, CPAP machine. So the CPAP machine is put on the face, which will cover the nose and mouth, or sometimes the nose only and sometimes the mouth only, basically delivering continuous airway pressure into the client's lungs in the presence of sleep apnea. So you want to teach the client to follow diet and exercise regimen, follow up with specialists to make sure that they get their CPAP settings adjusted as needed. And also you want to teach them to clean their machines very thoroughly, with each use, because the machine accumulates sometimes humidity. So you don't want the humidity to grow certain types of bacteria. So they must be able to, or teach them to clean their machines very thoroughly. So that is it for sleep apnea. Notice that if the client does not manage the sleep apnea, it can lead to complications such as, heart failure, heart attacks, or respiratory problems. So they must follow up to make sure they receive the treatment they need. Also teach them to avoid medications that may increase, sleep apnea, such as benzodiazepines, barbiturates, because if they're having a hard time staying awake, this will make it worse, okay? This will make it worse during the day. So that it is for about sleep apnea. Thank you for following me. And this is Dr. Bill with EZ2PASSNCLEX, EZ2PASSNCLEX.com.